Spectacular is sponsored by Soaky Mountain Water Park. You're watching News 2 at 4.
Welcome into News 2 at 4. I'm Eric Egan.
And I'm Erica Francis. Some small business owners aren't mincing words when it comes to Nashville's response to public health violations.
Oh, yeah. Alex Dennis is at the WKRN.com alert desk with their frustrated plea to the mayor's office, Alex.
Well, Eric and Erica, several owners of small bars in Nashville today say that they are fed up. They are tired of keeping their doors closed and their employees out of work while watching other businesses blatantly violate the public health orders set forth by the mayor's office.
We're compassionate and understanding the mandates in town and why they're put in place. And hot spots are bars and where people heavily socialize. However, when we're told to close our business and we have to look all of our employees in the eyes and tell them they no longer have jobs because our PP ran out because a game changed 6 weeks in, and then we get the displeasure of watching the party buses downtown and midtown and all the shenanigans of these private BS parties happen. It's beyond frustration. It's insulting, it's painful, and it's equivalent to getting punched in the face.
Well, the small business owners are now calling on the mayor's office to step up and enforce the mandates so that all businesses can safely reopen sooner rather than later. Erica.
Alex, thank you so much. Volunteers are still needed for a phase 3 clinical trial of an investigational vaccine for COVID-19. News 2's Alex Dennis spoke to the director of the National Institute of Health about the timeline and safety measures being taken to bring the vaccine to market.
Dr. Francis Collins, director of the National Institutes of Health, is ready for answers.
We all want to figure out how to put this COVID-19 virus, this bad guy, in the rearview mirror.
The NIH has started the mRNA 1273 vaccine trial in 89 clinical research sites in the U.S. located in emerging hot zones.
We know this virus is out there in Nashville. This is a place where we want to test it and see if it works.
The phase 3 trial will take place at Vanderbilt, and the following volunteers are needed. Those over the age of 18 with frequent close contact with others who may be infected, like healthcare, factory, and retail employees, people over the age of 65 with or without risks, and those younger than 65 with at least one risk factor, such as chronic lung disease, asthma, cardiac disease, severe obesity, diabetes, or liver disease.
It's a 1 dose on day 1 and another dose on day 28. It's a 2-dose vaccine. And then you get watched for 2 or 3 months to see what happens.
What would you say to those who are concerned that in an effort to prove efficacy quickly, you're compromising safety?
Thanks for that question, Alex, because I think people are concerned. This is called, the government effort is called Operation Warp Speed, which is supposed to indicate how rapidly we're trying to move. But I think it also makes people worry a little bit about, wait a minute, are you cutting corners here?
Dr. Collins continues by explaining the process.
The part we're doing that's rapid is to deal with some of those bureaucratic delays, which often take a vaccine years to develop. And none of those are being allowed. But the actual conduct of the trial and the assessment of the results will be as rigorous as it has ever been. And the FDA will not approve any vaccine that doesn't measure up to the highest standards of being safe and effective.
Alex Dennis, News 2.
All right, if you would like to take part in a vaccine trial, visit coronavirus.gov to sign up. Eric?
With practically every country working on treatment and a cure for COVID-19, clinical trials seem to be moving at a breakneck speed. That's good. Eli Lilly and company is already moving into a last phase trial of its antibody treatment. The pharmaceutical giant has recruited 2,400 nursing home residents and staff. That's important. The company, and for that matter, the world, hoping it will offer protection, possibly ease symptoms for those who are infected. The focus of this trial is to determine if a single dose reduces the rate of infection over a month. It will also determine if it can reduce COVID-19 complications over 2 months.
Health officials say the U.S. still doesn't have a grasp on the spreading coronavirus. Our nation accounts for more than a quarter of the COVID-19 cases around the world. The White House Coronavirus Task Force believes we are in a new phase of this pandemic. The CDC now predicting about 20,000 more deaths in the next 3 weeks. That's about 1,000 a day.
We haven't controlled this virus in a serious way. We're seeing rises in a lot of states, and now we're talking about reopening schools and colleges in the midst of that, which I think is just going to compound our problems significantly.
Some health experts say stay-at-home orders may be necessary to slow the spread down to a manageable level.
Today, Dixon County schools welcome students for the start of an unprecedented school year. Julia Palazzo spoke with high school parents about how they feel sending their kids back to class.
The principal of Dickson County High School says there were no jitters here on the first day of school, but rather excitement. The last time Dickson County students were in school was March 10th. The district has been planning this day for weeks. Changes here at the high school include assigned seating in all classrooms in the cafeteria. Teachers have cleaned out clutter to make as much room as possible and are uploading materials to Google Classroom instead of handing out papers. Also, no visitors allowed inside of the building. If a parent needs to drop something off, they can do so at the white tent set up outside of the entrance to the main office. Masks are not required, only if social distancing isn't possible. But we saw the overwhelming majority of students and teachers wearing one. Parents have mixed feelings about sending their children back during the pandemic.
I think it's too early. Corona.
Tell me a little bit more about your concern.
It's bad. They don't need to be in school right now.
He's healthy, and I mean, I'm not worried about getting sick, and I'm not young, but I'm healthy, and I just think it would be a really bad case of the flu, and I've had that before, and I think he's young and healthy, and so if he gets sick, he'll be sick, he'll get over it, and then, you know, when he's well, he'll come back. So I'm just not worried about it at all.
The district is starting with a staggered schedule. Today, students with the last names A through L were welcomed back. They'll return tomorrow. Then on Wednesday and Thursday, students with the last names M through Z will come back to class. And by Friday, all students will be back together. Reporting in Dixon, Julia Palazzo, News 2.
Julia, thank you. Of course, we know, folks, every district is doing it a little bit different. Metro Nashville Public Schools, they begin classes tomorrow, but that will be done completely virtually.
A wild time, Eric. Thank you.